this is honestly, it is a good transition here because what Mo had been talking about quite a bit there was the leverage buyouts, and that's really the underpinning of private equity and Americans for Financial Reform as a 501c4, really looking at solutions for that and raising awareness of it. So Carter is the communications director and going to give some background on the probably more about private equity in the larger picture and the Stop Wall Street Looting Act.
Thanks very much, Mitch. First of all, can everyone see the presentation? Somebody say yes, please.
Yes.
Okay. So first I want to start off by telling you what Americans for Financial Reform and emergency physicians have in common. AFR is a coalition of about 200 groups ranging in size from the AFL-CIO to very small local nonprofits doing work in their communities. And I'm not making this up when I say our COO refers to us as an emergency room, because we have all these members with different kinds of capacity to do what they do in advocacy, and we lend a hand where they need help. Big players like the AFL, obviously less so, but for small folks, we might offer them advice on communications, how to formulate policy, consultations with experts. And in the case of emergency medicine, we found a emergency physician named Dr. Mitchell Lee on Twitter, reached out to him, and thus unfolded a big conversation about the role of private equity. So I'm really happy that that we're in touch with you. I'm going to talk a little bit about how to make your case about the influence of private equity on emergency medicine, and in particular, how to tell your story effectively. The first thing I want to emphasize is that you have a great story with a problem, a villain, and a solution. And you should not shy away from talking about it. You can be honest and authentic and effective all at the same time. There is no sleight of hand need here. You have a case where you talk about the harm to patients above all, but also to doctors by the presence of private equity in emergency medicine. You have the argument that emergency care is vital for healthcare overall. I just redid this presentation to put in Dr. Mulligan's point about 61% of hospital care is emergency care. Rich Wall Street guys are getting richer here to no obvious benefit of medicine. Emergency medicine has gotten away from its noble roots, its sort of social justice oriented roots, and I'll talk about that a little bit more. And finally, the right ideas are there for reform. I wanted to add one more point here, which is try to avoid picking fights with other medical professions. That's what the other side wants. They want to see you divided, and that's just something that's, that's just something that's never gonna advance your case. What is private equity? I won't dwell on this. We like to use the hashtag on Twitter, Pirate Equity, complete with the Jolly Roger. These are rebranded leverage buyouts, if you remember that from the 1980s. They gather money, use lots of debt, buy companies, they cut costs, compromise services, sell off assets, lay off workers, raise prices, and sell the company. It's important to understand this debt-driven model at the heart of private equity, because this is what really results in the kinds of woes that you observe. Because if a company is heavily indebted, its owners have to squeeze cash out of it, both to pay the debt and to their profit. So if private equity is, as Mitch has commented to me, the worst incarnation of the corporatization of medicine, it's this debt-driven feature that's probably why. The problem broadly here is that the private equity is simply so pervasive, and I won't dwell on this outside of medicine, but it's really mind-boggling. There are more companies owned by private equity than listed on all American stock exchanges combined. You name it, they're everywhere. And, oh, wow, that graphic doesn't look too good. But all sorts of things, mobile homes, healthcare of all kinds, logistics, retail, insurance. My favorite is the cheerleading industry. The private equity industry actually has a monopoly in cheerleading. Oh, there we go. Someone was too clever, and they, you can see all these logos popping in. Cirque du Soleil, private equity, Krispy Kreme donuts. Okay. The problem in emergency medicine, I don't need to tell all of you. Blackstone, KKR, and Apollo have essentially locked up this business. This results in less attention from emergency physicians for patients, abuse of doctors. I'm not going to call it burnout. These are people who tend to their patients at their most vulnerable moments. I found myself thinking about the argument I used to make for why we should pay preschool teachers more, was because they are tending to our small children who are extremely in their very vulnerable phase of life. Finally, I want to address this issue of the betrayal of the proud tradition of emergency medicine. Mitch put me onto this article that many of you have no doubt read about the social justice history of emergency medicine. And I just found this absolutely fascinating and inspiring. You know, the story of the Cincinnati hospital setting up an emergency medicine resident program after a march on the hospital by poor residents of the city. This is something you can really lean into. And, you know, I'd like to emphasize as well that this is not necessarily a left-right argument, although you see these words social justice and you think that's a left argument. What I saw in this was a community coming together to find a solution to a healthcare problem without a whole lot of role of the government here. I'm not saying that's appropriate for every single circumstance, but there's no reason the history of emergency medicine has to be sort of shrouded in a kind of left rhetoric. You know, I'd also add this point here, which numerous people have addressed, of the professional association compromised by its industry ties. Mitch has talked to me a lot about that. And I think that's probably an important point you're going to need to mention, because you will inevitably be followed in your advocacy by people who want to say, well, I'm an EM doctor too, and let me tell you, there's no problem here. This is the villain of private equity. This is my own mascot. His name is the pinstriped plutocrat. It is mind-boggling how much money private equity has been referred to as a billionaire factory, because it creates so many billionaires. Schwartzman of Blackstone, worth $39 billion. That's triple the amount since the beginning of the pandemic. Same with the founder of KKR and the Apollo guys. They even got government money during the pandemic. And their money yields political power in the form of contributions, in the form of lobbying. This is simply a very, very powerful industry. Fortunately, there's a solution, and I'd like to really lean into this, because I think I have heard a lot of people, a lot of professionals, you know, really anguishing about the present and future of their profession. And I want to encourage you to think about moving from diagnosing the problem to the advocacy for the solution. This here is a picture of my boss, Lisa Donner, who was speaking at the first introduction of the Stop Wall Street Looting Act, which is sponsored by a number of senators and members of Congress. Lisa is my boss, and she's a sort of wonky issue campaigns are her specialty. She understands both policy, and she knows how to organize people and projects that down through the organization. And this is the sort of thing that it's not going to be easy and it's not going to be quick, but with careful organization, it can be done. I want to give you hope here. So what does the Stop Wall Street Looting Act do? It doesn't really focus on a single industry. You won't read this and say, oh, here's healthcare, here's retail, or whatever. It changes the economics of private equity to align the incentives. So the incentives are not to buy up companies and squeeze them for cash. Now, it also puts the private equity executives on the hook for good decisions and bad ones, because right now, through the use of debt, private equity executives can do all these things, and it's not really their money they're playing with. That's a very small slice of their own money. It also ensures that financial enablers of private equity, which is to say the big banks, take some responsibility here. It protects employees. This is particularly important as it regards pensions and severance payments. And then it also tries to impose some transparency here so investors in this space can understand a little bit more about what is happening. My last slide here is these are our hashtags that we use: private equity, pirate equity, stop Wall Street looting. We make a lot of use of the Jolly Roger in this particular campaign. But I would encourage you, there's a couple things you can do if you would like to see what's going on here. First, you can follow these two Twitters, and you can go to stopwallstreetlooting.org, and you can sign a petition that AFR has started. This will get you our regular updates on what we're up to here, but probably social media is going to be useful to you. Now, I'm taking a peek at some of the questions here. Yes, Petco, and Petco has been terrible to its employees, especially during the pandemic. I'm sorry to hear that. With this awful debt accumulation, are we setting ourselves up for a huge crash? This is a very good question, Dr. Whit Fisher, I see here. If you ever see stuff in the financial press about what's called leverage lending, this is the private equity industry behind this. And we are actually in the midst of some research to try to understand how dangerous this debt buildup is for the financial system as a whole. But it's a very, very good question. And it's something we are looking into more and more. I was glad to hear the amen chorus here from Brad Dreyfus. Amen to not picking fights with other medical professions. You know, I would say that the backdrop to that issue is that the private equity model is always going to look to squeeze people, and the efficiencies, the cost cutting gained from it, whether it's from replacing somebody who costs this much money to this much less, is going to go to the owners, the private equity firm. It's not going to accumulate to the professionals or to care of the patients. So I think for that reason, you really need to sort of keep your eyes focused on who the real villain is. I think you also should probably bear in mind there will be a lot of efforts to distract, say, hey, let's focus on these evil insurers, that sort of stuff. I think, you know, you really benefit by staying focused on the private equity question. Terry Mulligan is again leaving us with a pessimistic question. Is the hospital system going to crash? It's a good question. It is a really good question, Terry. And I think let me put it this way. What gives me hope is watching dedicated professionals like you fight for it, but we're only going to get there if we fight for it. So, you know, by all means, get engaged in this fight, stay in touch with Take Medicine Back, and stay in touch with Mitch Lee, man. We've started calling Mitch Hurricane Mitch in our office because he is so full of energy and passion about this, and it's really, really great to see. I'm going to put my email address in the chat as well, so if anyone would like to be in touch with a more specific question, I am happy to answer it. And I'm happy to answer any other question more, but I'm also happy to hand it back to Hurricane Mitch. Natalie, I see your question here. I wasn't referring so much to physicians who enable the corporate practice as I have noticed friction between things like EM doctors and nurse practitioners. And that's the sort of thing where I've noticed that that's probably going to end up being counterproductive to taking on the corporate practitioners. In the case of physicians who enable this sort of thing, who are on the boards of private equity owned companies, that sort of stuff, I think it's really important that, you know, it's phenomenal that you are able to resist the obvious pressure not to name names and say that, because it becomes important in an advocacy context that you can, that if you walk in and say, hey, I'm an emergency doctor and here are the problems, that when somebody else walks in and says, hey, I'm an emergency doctor and there's no problem here, you know, you need to be able to call that person out. That's important. I see a question. A raised hand.
Hi.
Hi, I know Leo Houston from Twitter.
Yeah, I guess I actually didn't see this tweet, And so you said like the most important thing is organization. You have a petition, that's great. Thank God we're all here. But what's the best way to spread the word, in your opinion, about what you're doing so that people actually hear the message?
Yeah. So we engage in a multi-pronged effort on this through social media, through earned media, through legislative work, through constantly trying to recruit new groups and new people to the fight. I would say, let me sort of couch that in terms of what I think you best can do, and it's first of all to continue the conversation with your peers, and to give them manageable things to do. And it can be as simple as social media. It can be as simple as writing a letter to the editor when you see a story in the New York Times about emergency medicine or something like that, and naming names here, naming the trouble here, private equity, that sort of thing. But it's this piece by piece, raising awareness, making the argument, and synthesizing it into actionable. What's actionable, and to that end, per my metaphor of AFR being an emergency room, we're happy to have the conversation anytime. If you pull together a group that wants to learn more about how this will work, we can do that. That's what we're here for.
Carter, thanks. I'm going to jump in a little bit with the NPV issue or question, because this is a central issue, right? I mean, we're seeing that this is a patient safety issue, but we know it's politically precarious, I should say, because we can make enemies and undermine our message, and they want us fighting. So I think we're really in a tough position of advocating for transparency, and I think that's where we can stick to that. I'll let Natalie Newman jump in right here, because I know she's very passionate about this. And this also, Natalie, I think you and Megan Gaylor are going to speak to, and you can explain it right now, our position on notional supervision, which I think anybody can agree with in any world. But go ahead, Natalie.
Natalie, you are muted.
Yeah. This is Dr. Newman, and Dr. Newman is one of our founding members as well.
Ah,
hi, Carter. Nice to meet you.
All those names that I see without putting faces to it.
Yeah, well, what I'm going to say tomorrow won't be nice. It'll be brief, like it always is. But what I want to emphasize is this: when people say that we're picking fights with NPs and PAs, to understand a little bit of background of that. They both have umbrella organizations, American Association of Nurse Practitioners and American Academy of Physician Assistants. They make, now the American Association, or the AANP, the Nurse Practitioner Organization, has made it clear that they want to achieve pay parity with physicians, and they want to achieve professional parity. Okay, that's not possible because they're completely different discipline, but that's their goal, and that is a written goal they have on their website. Okay, so in doing that, part of that is to achieve independence in each state where nurse practitioners can practice without the supervision of a doctor. We are against that because they are not trained in they have no formal medical training. Okay, so they can see all the patients that I see like in an ER with no supervision, but they haven't been trained in the 7 years that I had training. For me to even become before I could practice independently, I had to go through training for 7 years. Theirs is nowhere near equivalent, not even close. And they're nurses, it's a different discipline. So when we make the argument, we have to make it clear that, first of all, they're not ignorant to this. They know what the issues are, but what they are taking advantage of is a loophole created by this private equity CPOM issue. And the loopholes that's created is that this debt-driven entity that wants to make a profit increases their profit by hiring cheaper labor that appears to practice the same as physicians. And so their schools have exploded because the ACA allowed for that You know, I love President Obama, but one of his biggest mistakes with the ACA was in believing that NPs and primary care doctors practice the same. So funding was provided for that. That opened up a whole slew of online NP programs. So NPs can literally be trained online, have no RN experience, graduate, get their certificate, and then go practice in an ER and not know how to do an IV, not ever having practiced as an RN. But they do get the RN. It's a combined program, these entry-level programs. A lot of people don't know this information. So when we raise these issues, they think we're picking on NPs, but they don't understand the background. What I do on Twitter is I educate people on that background, the lay people, that they understand that, and that, yes, I do fight against people who take advantage of the loopholes. And yes, I am going to say something about it because they're not ignorant. They're not helpless victims. They're going into this with their eyes wide open, but they are benefiting from it. So they continue to do it. And so I think that's a fight that, you know, that's a case where it looks like we're being pitted against each other. I don't see it that way. I see it as those who know that they're taking advantage of the loopholes provided by CPOM put themselves in that position. They made a choice. Okay, so you have good NP programs. There are nurses who know their scope of practice. There are PAs who know their scope of practice. And then there are people who know it and don't care. They want the freedom, the prestige, the title, the attention, whatever they perceive comes with being a physician without going through the proper channels to become trained as a physician. And the laws are allowing that. When FP8 full practice authority laws, which allow NPs to practice independently, optimal team practice, which allow PAs to practice independently, that enables them to do that. We have to say something about their actions as well. And that to me is not picking fights. I think that minimum.
Yeah, I apologize if that if I offended with the phrase of picking fights. My only sort of overarching thought here is that when it comes to solutions, you know, I could imagine this, you know, working well across medicine for all professions, you know, reforming and getting private equity out. You know, but these are a savvy bunch with a lot of money, and they will be alert to, you know, any ways they can divide people. So,
right,
you know, they try it with us.
Thanks, Dr. Newman and Carter. And this is one of the most.
Hey, I'd love to. Sorry, I'll message him.
Oh, okay. Yeah, I do want to get on to Dr. Lawhorn here, but actually, to transition there, I mean, this is one of the most difficult items for us to address because there is a real patient safety issue. There are certain NPs that are not innocent. They're not, it's not all heart of a nurse. They're looking to profit off of this, or they're riding that wave. But what I always like to bring this back to is that if we are not choosing who works, if we're not in control of the staffing, then, you know, there's no point in really fighting this. And even FPA, who cares if they have full practice authority if a corporation is staffing them? You know, they'll have a rubber stamp physician on there, and that's our perspective, that there should either be the liability that a physician has, or there should be true supervision and nothing in between.